Put on the cloud.
Okay, super.
Thank you.
So we said that for the last session, when I'm in person, we would talk about next steps or remaining questions or something like this. I thought that by the time we got to this, I would know what that meant. And we, in part, actually, so one thing that happened this year during data collection, um, uh, we were supposed to just collect data through December, basically have it be August through December. And then October 7th happened. And so we paused data collection. So we had collected 100 interviews before October 7th, or yeah, around then. There were a couple that trickled in afterwards that we had scheduled, but about 100 interviews. But we hadn't met our quota in all of the categories that we wanted to meet. Like we wanted to have 25 in each category of reasons that people were having abortions and generations and religious identities and things like this. And we didn't meet that. So we decided to pause data collection so one of the people on our team is a social work PhD, and she's trained in trauma-informed care. And she's on the team in part because of that and because of her specialty in reproductive care and reproductive trauma as a social worker. And she very wisely suggested that we pause data collection after October 7th and not try to recruit anymore for a while out of a concern for the Jewish community's sense of trauma or feelings of trauma. And I think it was definitely the right decision. So what that means is we've just reopened data collection and started re-recruiting about a week ago, and the responses are flowing in, which is great. But it means that when we originally planned this series, I thought I would know more about our data by the end of the series, and that our April meeting was going to be some sort of culmination. And I don't feel like we can culminate yet, although I'm going to still think about it and think about what we could do. But I'm also turning to all of you, especially those of you who have been with us for several sessions. What are the other questions that you have about the data that we've collected that I could kind of put together a presentation that answers some of those questions? Okay, somebody has a question. Yes.
I did. My question is, are you going to list the years that you're looking for the data so that people can respond to? Because I know before you shut it off, there were a lot of the categories that were already filled. You didn't need any more for those sections.
Yeah.
Will you be posting what you need?
It's a great question. Like in our new round of recruitment, are we going to post what we need? Yeah.
Yes.
So right. It's a great question. And we talked about this as a team. The truth is, for the survey, we need everybody. We still have, so remember, we have a whole survey component, and then folks can opt into an interview. So basically what we're doing is, if you've opted into an interview, but we've reached our quota on the categories that you meet, then we reach out to folks and we say, thank you very much for volunteering. At this point, we're not going to interview you. But we still need their survey data, because the more responses that we have, regardless of category, the more statistically significant our data is. So we still, at this point, only have 200 survey responses. And our statistician is happy about that number, but would like us to get to 300 for the sake of making it a little bit more statistically significant. So for that reason, I don't want to start limiting folks. But it's a great question, and we did talk about it. Amy, yeah, question.
I don't know if this is actually the kind of question that you're looking for, but I will say that I still don't understand what's different about Jewish women and abortion.
Great question.
And that's where I'm struggling. And that was my curiosity for this entire series was I going to understand, do Jewish women regard or do or have abortions somehow different from the general population? And I don't know, is there an answer to that? Or do you think there will be, or does it matter? I just don't know.
Great. Okay. So you're pointing out that part of what you are interested in is actually comparing, in other words, what we know about non-Jewish women who've had abortions. And that I can certainly do in the last session because I'm also part of a team of people collecting interviews from Christians and Muslims who we have very few interviews from, but mostly Christian. I mean, my colleague probably has at least 80 or 90 interviews from Christians who are having abortions now. So the data set isn't completely comparable, but it might help us. So I could, so that's great. So I can definitely talk about that. And we don't know that, but that's the only data set there is. In other words, the major centers that are collecting information on patients, on abortion patients, are not collecting information on religious affiliation. So I can talk about and be more explicit in the last session about how Jews in this sample are similar or different from the general population based on that data. And I can give some comparisons with Christians from the other set of interviews that I could totally do. So that might be really interesting. Does that sound right, Amy? I think that's what.
Yeah, I do.
we could
As
talk
I
about
said,
that.
I've struggled all alone just to understand, are Jews different? And I'm curious what you will have to say.
Yeah. So, okay. So I think we're going to see something today that's going to indicate that Jews are different. This has been my finding all along. But mostly what I was seeing from the other ones was that they're not. Okay, Alvin, and then Jim and Addie, and then we'll get into the data for today. Yeah.
I think you touched on this already, but more in depth, I would think that someone who is very observant, very orthodox, is less likely to have an abortion, perhaps, than someone who is reformed. I think you've kind of indicated that's not holding up, but maybe you can, spell it out more in terms of conservative Jews who are more religiously affiliated, maybe, or more observant in their life versus those that are just belong to a synagogue. I don't know if that's too in depth to be getting that information, but you would think there'd be differences. But it sounds like so far those aren't showing up.
Right. Okay. So this is in part of the problem with a smaller sample like we have. I can't say things like, are they more or less likely? But what I can say, and what my research team is unpacking right now, is the relationship between shame and stigma and religious affiliation. And that I can totally bring. In other words, because our sample is only collecting data from people who have had abortions, right? So we're not comparing them with people who haven't had abortions. So, but of those who have had abortions, we have a nice range of religious affiliation, and we've collected data about their sense of shame or stigma around that abortion. And that is something I can talk about so that is great. I love these suggestions. Okay. Yes. Jim and Addie, tell me what you're interested in.
Well, I'm assuming you have, and when you do the questionnaires, it includes like educational background, other demographic characteristics, profession, and so forth, and how whether those factors are more important than religious affiliation in terms of the similarity of results.
Yeah, we can definitely talk about educational levels, and stigma or shame as well. I think also, class, right? Sort of income. Okay, that's great too. All right, I can bring some of those for our last session. I think that's great. And then we can ask some of those questions. And Amy, I think the general question, what's different about Jewish women who have abortions, is a great kind of overall way of framing this. So thank you. Okay. So tonight we're gonna I brought, let's see, 70s, 80s, 90s, early 5 different sections, 5 different selections from 5 different interviews, each representing a different decade in which folks had an abortion. I first wanted to kind of ask you what you think you're going to see in terms of differences, like in the 70s. What are you expecting to see from somebody who had an abortion in the 70s, in terms of their attitude about pregnancy or sex and unplanned pregnancy? If they express any guilt or stigma, who do they tell? Things like this. What are you expecting to see from somebody in the 70s? Any guesses?
Pre-Roe or after Roe?
Right.
After Roe. Everybody's after Roe.
Roe,
Did you, so you did nothing when abortion was illegal?
Right.
Okay. Because most of my peers had abortions that were illegal.
Before. Okay. No, these are all post-Roe. Yeah, I know. Somebody suggested I start collecting from pre-Roe just because those folks are not going to be around so much longer, unfortunately. And we need to get those stories. I know. All right, but
I would
post-Roe.
expect that a number of the women would express gratitude that they have the freedom to make that choice legally.
Great. Gratitude.
I still think it would be in that decade quiet,
Like not telling people.
not publicized as much.
Okay. All right, let's see. Let's go to the transcript and see. Okay, I will share my screen. I did it just in a Word doc this time because it seemed, I don't know, cleaner. Okay, so this is participant number 6. So one of the things that we're tracking, right, in gathering interviews from across these decades is to see what kind of change over time we can see among Jews who've had abortions. So this participant had 2 abortions before she had any kids. She grew up Reform. She's from California. For both abortions, she just wasn't ready to be a parent. And for both, it was, she describes it as a whoops. She was in no committed relationship. It was unprotected sex, spontaneous. She says it was probably as a result of the era in which experiencing equality and open spontaneous sex as a result of the era and the change in feminism. We felt free to act as we wanted, but we weren't always capable of discussing the nitty-gritty protections that needed to take place. I think those were not quite caught up, at least in my experience. Not everybody felt comfortable in the spontaneity, making sure that all the I's were dotted and the T's were crossed, as it were, for protecting oneself. So that was a kind of, I think, era fallout where you could be spontaneous sexually, but not necessarily have the right words or feel comfortable as a female advocating for your own protection and pregnancy prevention. So, see, she's reflecting this sense in the 70s, the second half of the 70s, that she felt really free sexually, right? That was part of the milieu around her. And yet she wasn't still quite comfortable talking about protections around sex with her partners. And so that's how she ended up pregnant. She then talks about, the researcher asked her, how did you go about making the decision? She said she worked in the medical field at the time, so I was really comfortable. I'd worked on women's healthcare since college, so that was very comfortable to her. That being said, I told you it was hard to discuss unprotected sex. Maybe that was me personally, but I'd been very comfortable in healthcare. Both of these pregnancies were accidents, and they felt like something was invading my body. She then compares it to when she had 2 babies later. And she says, when she had 2 babies, you were overjoyed that you found out you were pregnant. And this was like something was invading my body. If someone told you you'd had a tumor that's growing on its own, that's what it felt like. That's what it felt like to me. My body was doing something unanticipated, unexpected, albeit under my not good watch. So she recognizes again that it was due to this unprotected sex that she was having, but it wasn't part of me. She goes on not a positive experience. She wanted to know, how fast can I handle this? How easily and how fast can I return my body to normal? She says, the researcher then asked, did you talk to anyone about making the decision? She said, no, there was no need to do any of that. I was so clear in what I needed for myself. I didn't have guilt. I had no secondary thoughts. I was just filled with gratitude. Who said gratitude? That I'd come of age after Roe v. Wade. Then she says, and so with that, who have you spoken to about your experience after the abortion? The researcher asks. And she says, first of all, a lot of my friends had drove other friends home from abortions. It was something that happened. It became part of our experiences living in the 70s, early 70s, and the women's movement. It was part and parcel. It wasn't anything you shared among a lot of us, but it was as an experience. It was shared among a lot of us as an experience. It was kind of part and parcel of the dialogue of a sexually active life. So we definitely had that sense of gratitude. But I think also this is very kind of reflective of at least what I've learned about the 70s as this time of sexual freedom, of exploration for a particular subset of women, and yet also the tension that she feels in the fact that they weren't talking about contraception, even though there was this great sense of sexual freedom. Was this surprising to anybody, or did it resonate with anybody? It resonates. Addie's shaking, Addie's nodding. It resonates.
It definitely resonates. I have a sister 12 years younger who was in the middle of the whole sexual revolution. I was at the beginning
worked
of
for
the women's
Planned
revolution,
Parenthood.
and stuff. And
She
yeah,
was
she
a
worked for Planned
counselor.
Parenthood, yeah. And yes, it
What-
definitely resonated.
When
Yeah.
was the pill?
Oh, well, when was the pill? So the pill was legalized in the 60s, but only available to married women first.
That's right.
So I'm not sure when it was actually available
that
to
approved.
unmarried women.
Yeah.
That's a good question.
What I think is interesting is I'm sort of in between those periods, but the real shift that has taken place in my lifetime is coming from that place of once abortion was legalized, it became normalized. As she says, it was just something that people did. Nobody in my milieu looked upon it as something to be ashamed of, or, these were just accidents that happened. But at the same time, there really was no education about how you prevent pregnancy, even though people weren't using it as birth control. They really weren't, but there was not really a in-depth discussion, although I'm of the age where pretty much everyone I knew was on the pill. Once it moved out of married women only, everybody in college, that was what they did. But that's always been the gap for me. As I always said, it's like, if you want to ban abortion, well, then you need to also teach people about contraception.
Completely.
And that's always been a gap, but it's really been that shift. I've seen that entire arc from something that's just part of the normal experience to something that is evil incarnate.
Yeah. Alvin, sure.
Yeah, I quite expected to hear that sexual freedom issue. I was about to raise my hand before when you asked that question, because that's what the 70s were all about.
Yeah.
I find it interesting that there's an implication here that her partners, the males, were totally irresponsible as well. They could care less about having sex with her and what it might do. Like, she's the one who had to worry about the protection. But when you think about it, it takes two to tango. So the guys should have been involved as well. And these weren't married at the time. I guess the couples, I take it, they were partners, but still, that's something that it surprises me. It doesn't surprise me either, that the guys are totally here for the fun and could care less about what happens.
Yeah. And condoms were around. I mean,
Definitely.
right. And yet there's, the men are equally responsible, and they seem to not be,
We're all people.
she doesn't even implicate her partners. And it was her, it's almost like she was the one who was irresponsible, and she knows that, and she's okay with it, but
that also is part of that whole movement of feminists. It's like, it's your body, it's your responsibility, you control it. It was almost as if the men were an afterthought. They were simply there to be used, to have fun. And, nobody talked about condoms until AIDS.
Right. Oh, that's really interesting. Oh, okay. Yeah. Oh, I wonder if I'll find that. Yeah. Phil Sachs. I don't know who's who. Can you, who's?
Oh, that's okay. You
Okay.
could tell me.
March,
Okay.
the pill was legalized for all Americans in March of 1972.
Oh, wow. So it was available to her already in 73, by 74, 75. Right. So
Absolutely.
I don't know. But you know, the pill has a lot of side effects. Maybe she tried it and she didn't like it. Maybe she couldn't get access. Who knows?
You had trouble with it.
But that's really interesting.
You had trouble with it.
Yeah, I couldn't take it.
Yeah. A lot of people can't take it. Yeah.
I tried 3
And
different
then-
kinds.
And then I assume, I mean, you could look this up too, right? How many versions there actually were in 1972. I would be shocked if there was more than 1 or 2. Now
there
there are a
was-
lot of
there were.
variations.
And then,
Yeah.
Now
there's
there are a lot
3.
of variations, but in early time it probably wasn't. Okay, let's look at the one from 1980s. Any guess about what we're going to see in the 80s? Any cultural references? We're going to get some good cultural references in this one. Nothing? All right. I'll take a gander. All right, here's our participant from the 80s. She's from Massachusetts. Oh, I tried to find all the same kind of religious identity in this bunch so that wasn't a different variable. So that's why you're seeing all kind of secular, cultural, or liberal Jews in this one. So she's from Massachusetts. This is number 22. She's a secular cultural Jew, and she terminated for health-related reasons. So she says, somebody always asks her, what would you have avoided? And she said, what could we have done to avoid this in the future? There's nothing you can do. It was a total fluke. There was just a diagnosis with the fetus. So even that starts increasing in the 80s, right? The fact that we then knew more about fetal development and she could make a decision about fetal development in the 80s. My mom always told, I was born in 83. My mom says I was the first time that she could have an ultrasound. Even I have 2 older brothers, and she said she didn't get ultrasounds with them. So that's a difference. She says, but we were able to have a family after that. So then they got really involved in activism. And she said, we got so involved so quickly with NARAL and the Religious Coalition for Abortion Rights at that point, because during the labor for her next child, we turned on the TV and Ronald Reagan announced his intention to run for re-election. And one of his causes that he was going to platform was that he was going to stop the murder of 1 million babies a year, stop these parents from this terrible devastation. And my husband and I wrote a letter as soon as I delivered, and we sent it to that woman who's going to be our next vice president, Geraldine Ferraro, and she bounced it up the chain to NARAL. And we became national speakers. We spoke at 2 different rallies, the Silent No More rally and the 40 More Years rally. I was 33 weeks pregnant with my second and with the first child who was a viable child. So during her abortion, Ronald Reagan announced his intention to run for president. And that was remarkable. That was such a significant moment for her. So she says, so, you know, we were very clearly pro-choice and pro-life because we wanted life to continue. And we understood that there are choices that people make that we had to protect. And one of which was a medical abortion, but also we understood that there are lots of different reasons why women get abortions. And we were going to fight for every woman who felt that she had made this decision. And it was a good decision for her. We wanted to make sure that it was both safe and legal. Okay, so does this one resonated a lot with I mean, the references are very strong in this one. They're kind of overt. Anybody surprised?
She's married.
She's married. Yes. Yeah, she was married. Their first child together. There were fetal anomalies that were discovered as a result of the advancement in prenatal testing that could be done in the 80s.
Because in the 70s, it was the ones that were unmarried, and you didn't have any that were married that had it.
Right. Maybe not. Right. Well, the married ones, and this is curious. Now I'm curious because there were also hospital committees in some jurisdictions. Even after Roe, I think there were some hospital committees. Maybe it was before Roe. I'd have to look into that. But who wouldn't let you have an abortion if you were married?
It was the introduction of medicine being run by lawyers.
Yeah, medicine being run by lawyers and committee.
Mhm.
I love the reference to Reagan in this one and Ferraro. I think that's so great that she reached right out to both to Ferraro and became a national speaker. But I also think what's really powerful about this one is that she identifies as both pro-choice and pro-life. In other words, that the terms hadn't become so polarized yet. That you could be, supportive of women's choices and and that includes women who want to have children. It seems like it was almost this moment where things weren't so divisive, does that resonate with folks? Is that like your memory of the 80s and the abortion debate? Does that sound right or no?
Well, our kids are born in the 70s.
Yes, that'll also show what a nerd I am. I remember being absolutely infuriated at the Hyde Amendment, that they decided that poor women would have no choice, but everybody else could have a choice. And it remains on the books to this day. And it is as appalling today as it was the day it was passed.
Yeah.
Apparently poor is a crime.
That's right. Being poor is a crime. Yeah. Yeah. Okay. Okay, let's move on to the 90s. Okay, guesses about what we're going to see in the 90s? Somebody getting an abortion, think? What are the obstacles that's going to be in front of
I was
that?
going to say, yeah, that's going to be the people blocking the entrances and being in their face.
Picketings.
All of that.
Picketers. What about she talks about relations with her family. What's her family going to feel about this? What do you think?
I think they're more independent. They would.
More independent in the 90s?
I can't imagine people asking if their family said approval.
Mm-mm.
I don't know.
All right, let's see. So this person's from Washington, that does not have a religious affiliation, and it just wasn't the right time. She was not married. So the researcher asked, talk to me a little bit about the procedure. Where did you go? Was it hard to find somebody? This part I loved. This was before the internet. So I actually got the phone. I actually got the phone book and looked up a place in the phone book. This is why I think this is so hilarious that I'm sharing this today. Our phone book actually arrived in the mail today. I don't recall ever getting a phone book, but before to my house. Do you all get phone books? I don't even get. I don't think
Once in a while somebody drops something.
Yeah,
off.
like
Not
once
like it
in
used
a
to.
while. So it happened. It's definitely not an annual thing. I don't know how frequently it is, but it happened to come today. So I flipped through the phone book to see if there was a listing for abortion, and there isn't. There are things for there are listings for family planning though. So I have a feeling though, and I didn't recognize any of those clinics, so I don't know what they're doing. But anyway, okay. So she looked up a place in the phone book. I was living in LA at the time. It turned out to be a private clinic in Beverly Hills. So I just called them. They had a nice ad in the phone book and they talked to me. They scheduled it. They let me pay with a credit card. There are just what's kind of partially shocking about this compared to today is that now the clinics that are open have wait lists of 4 weeks or so before getting an abortion, because there are so not enough clinics to serve the people who need abortions.
The anesthesia.
Right. So anesthesia. Right. So, okay. So I went in there and I just drove there by myself. They asked me if I had someone to drive me home. I said, no, I haven't told anyone. So she was keeping this really private. And they said, well, then we can't give you anesthesia. We were going to give you some twilight anesthesia, but we can't now. So she did it without. It was a vacuum process that was pretty quick. It was like 10 minutes, just felt like bad cramps. She felt a little sick and achy and bleeding. She drove herself home. She stopped at the grocery store, got some magazines and a bunch of chocolate, and she went back to the room she was renting. So she found out she was pregnant when she was home visiting her parents. And so she had to wait a while. She didn't want to tell her parents. So that's what this is all about. So by the time she actually got the abortion, she was about 10 to 12 weeks. And the researcher asked, what was the waiting like for you? She says it was stressful. I wasn't sure if I was pregnant, and I thought maybe I am, but maybe it'll miscarriage. I was hoping for a miscarriage. I felt really stressed out being around my family and stuff in this weird space, but I was pretty sure. I mean, I was definitely sure I did not want to become a parent at that time. So the researcher asked, why didn't you feel like you could tell your parents? This is really interesting to me. I probably could have. It probably would have been fine, but I just felt uncomfortable doing it. I thought they would be judgmental toward me, not for a religious reason, just it was dumb to get into that situation. The guy had convinced me to have sex without a condom, and that was stupid. I should have refused. He just said, oh, I've never gotten anyone pregnant before, and blah, blah, blah. I'll pull out. I was stupid and believed all that stuff. So, I mean, me now as a more mature person, I would have been like, no way, get out of here. But as a 23-year-old, it's kind of easier. As a 23-year-old, it's kind of easier to convince. So what's fascinating to me about this, and this, I mean, Amy, you asked about what's different with Jewish women. This has stood out to me since we started doing this research, that when we speak to Christian women, what they are ashamed about is the abortion. They are ashamed and they feel that everybody will judge them because of the abortion, not because of the sex, not because they quote unquote let themselves get pregnant, but because they're having an abortion. Whereas we are finding consistently with Jewish women that the shame is around the sex and the unplanned pregnancy. This assumption that she should have known better, that she was dumb to get into that situation. That's the different stigma for Jewish women. We're finding this over and over again. And I think in the 90s, and this I should really, I'm seeing it more in the interviews from the 90s. But I could definitely look into that for next time. Does that sound right to folks? I mean, what do you think? That the stigma is around the sex or the unplanned pregnancy? Addie, what do you think? Jim? Yeah.
Yeah, well, two things. When you say the sex, it seems to me it may not be because they were sexually active, but because they were acting irresponsibly.
Right. Yeah. So the unplanned pregnancy in particular. Yeah.
60s, 70s.
But the other thing I want to know is when mifepristone became available. Because it became so much easier and now half the abortions are chemical abortions. So
this is late, not until 2010s.
Right.
Okay.
Not until the 2010s. And I only know that now because there's been like I had the impression that mifepristone was always around, and it was always around in Europe, not always, but it was around in Europe for a good decade and a half before it was available in the United States. Yeah. But I only know that because of all the lawsuits now, and there's been all this great historical research that's come out recently about it. So it really meant that because mifepristone has allowed people to have abortions more privately. You don't have to tell anybody. You don't even have to go to a clinic. So you're right. It's for these Jewish participants in the 90s that the fear is that they would be judged for getting pregnant and being quote unquote irresponsible or dumb. I think that is a particularly Jewish reaction because of the kinds of messages we send Jewish women about that they should be kind of smart and responsible. And it's kind of a model minority thing. But I think it's also a Jewish women thing. Those are the messages I inherited. And I don't think I'm alone in that. Amy, you have thoughts?
I'm not surprised that the shame is different because every single non-Jewish woman I've known who's gotten pregnant as a single woman would never have an abortion because and it's not a problem because you're creating a new soul.
Right.
And so it immediately moves away from the sex part and just, it's about the whole life thing. You can see the entire roots of the right to life movement in that. So I agree with your assessment. I think Jewish women, we told you should be smarter than that. You should have more control. You should be better. But definitely the opposite with the Christian. I mean, vast sweeping generalization, but just from the women I know, it's like, yep, doesn't matter. What's important is we have a new life.
Yeah, yeah, exactly, exactly. And that they would receive more judgment from particularly from their religious community, which means not their church so much, but from their mom who's religious if they had an abortion. Okay, Missy added also in the chat. I have more memory of freedom despite picketing in the 90s. I think there was a bit of secrecy. Yes, the stigma seems to be around the sex, right? So this participant didn't talk about picketing at the clinic, but several of our participants have, and I should try to see how frequent that is, and when that really shows up a lot more. But she seemed to be, the abortion was available for her in a free way, in an available way, despite the judgment. Okay, let's go early 2000s. Any thoughts? Anything that shifts? We'll take a look. All right, let's see what shifts in so this one's actually from 2009. I had a different one from 2004, and ultimately I think this was a better example of this trend. So this one's from New York. She identifies as a conservative Jew, and she didn't want a baby. She was not married at the time, if I'm remembering this correctly. She was not married. So the researcher asks her in particular this question about stigma and shame. And she says, the participant says, I think there's inherent stigma in abortion regardless. So that goes into why I wasn't readily open with the people in my life because it's still a stigmatized issue. And in the same way that maybe I wouldn't tell my mom that I was drinking or did drugs. So it's that same kind of concealing, but not necessarily, at least in my life, in my world, it didn't come from anti-abortion stigma, but from a stigma of young pregnancy. The researcher says, how did you feel about yourself? Did you feel any shame or anything like that? And the participant said, that's a great question. I think that I just really felt lost. And what I really did feel, though, was that I had always known that if I get pregnant before I'm ready, I will have an abortion. So there was no point at which like, oh God, I can't do this. I had the process right there. I just had to figure it out. In some ways, I was actually proud of myself for doing it. The first feeling I had after what absolute feeling I had when I came to after the surgery, I woke up from the anesthesia, that's not spelled correctly. The absolute first feeling I have is, oh my God, I can leave and I don't have to take this with me. I remember that so clearly. So I wanted to write a letter to the doctor thanking him for freeing me from this problem, but I was ashamed of us being pregnant. I was 21, I lived in New York City, and in my community, I wasn't in a religious community. I had religious friends who were having babies young, but in my world, it was expected to get a job, have a career, have a life before having a child, before settling down in that way. So just like this isn't what you do, even though I do have friends who had children young regardless, but like in my family, especially not expected or accepted that kind of experience. So the researcher emphasizes, so it was more the pregnancy than the abortion. She says, yes, more than the abortion. Even to this day, now in my 30s, I feel like I'd be fairly comfortable. Maybe like, yay, I had an abortion in college. What a crazy experience I had back then. Okay, there's already a comment. Great. Okay, who's got a comment in the chat? Okay. Who else has a thought? Who has a thought?
Well, it's definitely reflective of the time of women needing to develop a profession, establish themselves before committing to a family. That's a message of that time for sure.
Yeah, totally. The early 2000s, we see this a lot in the interviews. This expectation on women, right? This was the height of women can have it all. right? But the understanding that in order to have it all, they need to first have a career, right? That they need to do their education and be stable and have enough money and all these things. And that's where we see the effect of that today with lower birth rates, honestly, right? That's what we're seeing, that all of the kind of lamenting about late marriage and lower birth rate is a large part result of the kind of ways that the messages we were sending young women in the early 2000s. Alvin, yeah.
Yeah, she implies that being pregnant, or not having a child, but being pregnant is no big deal. Because if you don't want to be pregnant, you just go have an abortion. It's no big deal. Just run to the store, pick up an abortion, have it, and be done. And it's like, don't take life seriously because it's not your goal at the moment. That doesn't sit well with me. That's all I can respond to it.
Yeah, that's fair. I hear that. Yeah, she seems, I was even rereading this, that I was proud of myself for doing this, that was something, right? And it revealed to me the things that have been prioritized for her in her life. Maybe the things that she's prioritized in particular, right? That having a baby right now is not a priority. Oh, you have a call. Yes, Alvin, go ahead.
Yeah, I follow up that she made a comment. She's got Orthodox friends who are having babies at a young age, and for them, it's perfectly fine. And she's looking at that and saying, this is not what I want to do with my life.
Right.
Which is interesting because you might think that having those kinds of friends might change your thinking a little bit and saying, well, maybe not that young, but I don't want to wait too long because I see they're enjoying having children. But it clearly didn't have any effect on her in a positive way, not at all.
Right. Yeah, go ahead, Phil Sachs.
Yeah.
Yeah.
Did you know what you were saying?
I forgot.
Okay.
There's an interesting conundrum in the 2000s. Many of the evangelical Christian preachers are preaching Calvinism regardless of building wealth, that God wants you to be wealthy.
Yes.
And so you have a very early period, it's not real early, but there's a period of evangelical Christianity which wants people to be rich. On the other side, it's angry at women who try to do something to build a base before they have children. It's a really interesting sociological issue because I remember clearly, I guess the people who preceded Osteen, but perhaps even Osteen at that point, are saying, get out there, work hard. God wants you to be wealthy. And of course, you see them with their billion-dollar churches and things. And at the same time, there is this, but hold women back. You're not supposed to do it, but everybody else is supposed to. If you have a kid, just make that sacrifice. You're not part of this. It's just an interesting time.
It is. And it strikes me just the sad reality that, and I think it is a reality. I don't think it's, I don't think it's just a perception that you can either be kind of well-educated and have a successful career and all of these things, or have children really young. But it seems almost impossible to do both. Yeah, Jim, Addie.
I remember you haven't mentioned with anybody what the cost of the abortion as being a factor. And as far as I guess in most cases, it's not covered by insurance. Maybe for some medically necessary ones it would be, but certainly for the ones you're talking about, except for maybe one, it wouldn't have been. And not everybody would have that freedom. And a lot of stories you hear, how am I going to get the money to do it? And will the guy help pay for it and all this and that? And none of them talk about money being an obstacle.
That's a
Well,
great.
Dr. Raucher, is that
Yeah.
one of the ways the Jewish community is different?
That's just what I was going to say. Yep.
Because that's the rise of clinics and things like that. But most Jewish women, I think, don't go that route. That would be my guess.
Exactly. So we see two things in the interviews that differ, right? One is that there doesn't seem to be a problem collecting the money, however much it's going to cost. They charge it, or their partner splits it with them, or I don't know, some of them do talk about insurance covering it more recently, but definitely before the 2000s, that was not happening, except in medically necessary situations. But absolutely. So they don't talk about money as being an obstacle, but also, and this is something I really should track about a difference. So many of them talk about just knowing an OBGYN. which isn't surprising. I mean, Jews are actually very highly represented among abortion providers. This is a separate study that I want to do at some point to interview abortion providers who are Jewish. There are a lot of, they're overrepresented in the field, overrepresented, whatever that means. There are a lot of them. And so a lot of the women we talked to, they were like, oh yeah, I knew my father's, whatever, ex-roommate was an OBGYN. I knew him, and he either would do it or he would get her to somebody who could do it. And that happens so many times, and that is absolutely something we should track and look into. I love that. Oh, that's such a great question. And but you're right. And this actually speaks to, so the other data set that I've mentioned with interviews with Christians was supposed to be interviews with Jews, Christians, and Muslims who are having abortions now. Now, because we were tracking having abortions now, we figured the best way to track that was through clinics and to recruit through clinics, both independent and private clinics. But we're not getting many Jews. I mean, we have literally a handful of Jews compared to 80, 90 Christians. And I've had a hunch for a long time that Jews were not getting abortions at clinics. And I think that our research is confirming that. So
do you think that holds up even on college campuses?
Yeah, that's a great question. I don't know. I don't know. And the problem is now I think we have very high rates of birth control usage among Jews. That's just my sense among students. So that's really anecdata. So I don't think as many Jewish students are seeking abortions, but now, right, and this is just now, but now they can get mifepristone, and they know they can get mifepristone. I mean, a lot of college campuses offer it in vending machines now, or the Plan B you can get in vending machines. They know when they've had unprotected sex, and they immediately go and get Plan B. I don't know about a few decades ago. It's a great question. It's a great question. I love this group. You're giving me such great things to look for in the data. This is so great. Okay, let's do our last one from 2022. So this person, here, I'll share this. We got into a lot, who she told and who she didn't tell. This is our last person from 2022. This is number 85. She's from Massachusetts, conservative. She had children already, so she had a very long infertility journey. And then kind of, I guess she used the word miraculously got pregnant spontaneously after, like very soon after having a baby through fertility treatments, and suffered from postpartum depression and knew she just could not successfully raise the 2 kids that she had with a third. And so she terminated that pregnancy. So the researcher thanked her for sharing her fertility journey and the process of becoming a mom and what it looked like having this abortion. So she says, so this abortion was in 2022 after the pandemic, or, coming out of the pandemic, I guess. Did you ever think about what your support system was like and who you chose to share or not share? Or maybe the abortion was in 2020. I think it was 2020. This is a mistake. It was 2020. To share or not share the abortion story with at the time before lockdown. Right. She found out she was pregnant in February of 2020. And so pretty quickly had the abortion. I think I'm generally a pretty open person, but there were certainly, I had people that I told immediately that I was sort of panic stricken. I told obviously my husband and my parents and my brother and my best friends. And then afterwards, there were some people I told because I just felt like I needed support following the procedure, but I didn't feel shame. I didn't feel shameful about it or anything like that. I felt like I definitely had good support and people who were supportive of our decision. She asked, did you talk to anybody, consult with anyone in terms of the decision? She says she spoke to her doctor. Her doctor was really supportive of either decision and super non-judgmental. That's really the only person I consulted with outside of my husband. That's the only person I sought counsel from. Reflecting on it, the researcher says, it was a while back, you mentioned that you didn't necessarily experience barriers to accessing the abortion. So she was able to access the abortion. Were there any challenges? And then this is what she said. no challenges, but there was one nurse. There was this sort of one nurse that asked me when we got to the surgical center, she asked me why I was there. And I said I was having a D&C. And she asked if I had had a miscarriage. And I said, no. And she said, oh, do you have fibroids? And I said, no. And so she kept on questioning me. And it was not because I don't think she was judging me, but it was like I was kind of put on the spot to have to disclose that information to her, that she was a stranger, but it wasn't met with judgment. It was just, I think she was a little surprised when I said it. I think this person is a little generous about this reading. I think there was some judgment there, but that's my thing. Okay, the researcher then asks, is there anything you'd like to share about your experience about having an abortion, where we are in processing having the abortion? And the participant says, I guess I really feel grateful that it was an option to me. And I mourn for women right now in our country who don't have that access, and it tears me up. So I guess I never have regrets about my abortion. She thinks sometimes, what would it look like? And she feels really fortunate and grateful in the end. And then later on, she says also, I think that being Jewish right now is really challenging. Being a woman right now is really challenging. Seeking healthcare is challenging. But there are a lot of big pieces of my identity are on the chopping block right now, and that's scary. But also that's real life. And she says she wants people to band together as much as possible to keep fighting for equality and for rights. So there are two things that I am really struck by in this interview, and particularly putting them all together. So when we think about where we were in the 1970s with that interview, right? That person, this kind of sexual freedom, the no judgment attitude, that everybody's had an abortion or two kind of thing. And here she had a nurse who was kind of interrogating her about why she was having the abortion. And we know from studies of among people who've had abortions that they do experience a lot of judgment sometimes from abortion providers or from other medical professionals, not necessarily in a clinic, but in a hospital setting where they don't just do abortions. So that was really profound, that she experienced this judgment from the medical professional. And then, I mean, her reactions at the end, it feels like it's 180 degrees from where we were in 1973. In 1973, that woman was grateful to have that women had the opportunity to have abortions. And this woman in 2020 is mourning the loss for women. So yes, thoughts. Phil Sachs, what do you have?
I think that maybe giving the nurse a little bit more credit. Usually it's put down as a D&E, not a D&C. And
Okay.
maybe that's why she was questioning it so much, that
Okay.
it's a D&C when it's really a D&E.
Okay. That's helpful. I appreciate that. Okay. That's possible. Great.
One thing that struck me about all of these stories was the exception of, I should say, of the single women, is the lack of discussion with the partner. And that it's, I'm of two minds. As a woman, it's like, well, I think it is the woman's decision, but it makes me feel bad that the other people, that there's no relationship then, there's that separation. And that's what happened in the 70s a lot too, was that separation was sex was not for procreation. Sex was not part of a relationship. Sex was just sex. And I don't mean to condemn it, and I don't, but I think that's really reflected in the way that women approach their abortions too. It's just, I don't know, it just struck me.
Yeah, Sharon.
I was the woman in 2020 or 2022, what surprised me is why she didn't shut that provider down. In other words, she kept probing her, and I would have probably truthfully snapped at the person or said, I really don't want to discuss this with you, or I don't need to discuss this with you. I'm not here to discuss this with you, because really it was none of her business why she was there. But, this woman just kept coming at her, it seems like.
Yeah. I'm curious about that too, because it seems like the a participant didn't experience it as judgment, but upon reflecting on it, it seems like it was intrusive. Yeah, I think it's rare. I agree with you, and I might have done the same, but I think it's rare for people to snap back at medical providers like that. Don't you think? I mean, most people.
I think years ago it was. I think that now people, well, maybe I'm speaking for myself, but I feel that I'm in a in a more of a relationship with the people that provide my medical care.
Okay.
Now, maybe that's because I'm older. I can't say, but I do feel it's, somebody that works with me and I feel comfortable with, kind
Right.
of, but
Right. So this definitely wasn't. This was some random nurse who.
right.
Right. I hear you. Yeah. Any other thoughts reflecting on, we have a couple minutes left, reflecting on kind of the shifts from 73 to 2023, basically? Any other questions for the last time that we could look into? Alvin, yeah.
Yes, I'm wondering if it's another research project for you to try to talk to the partners of the women who've had abortions.
I think you've suggested this before.
Well, we might have, yes, but it seems to me that that's a missing piece of this. What is their feeling? Again, I would expect it to be somewhat different for a married couple versus a more casual sex relation like in the 70s partner thing. But I'm just curious how the guys are feeling about this whole thing.
Yeah, it's great. It's great. It's great. And I think there's definitely another study there. So Jewish abortion providers, as well as partners. Yep, totally.
Well, it would be nice too if we actually knew why women have abortions versus all the rhetoric that's out there. I mean, with the availability of contraception, I think people think, well, if you're on the pill or you're using condoms, you can't get pregnant. And it's like, yeah, it happens. So I think, to tone that down and to remove some of the judgment, it would be interesting to understand better.
Yeah, so that we do know, and I could, and I shared that, I think at one of our first classes, but I think that information is always useful for people. I mean, we know that most of the like 75% of abortions are because what we call timing reasons, right? Either not financially ready or relationship ready or educationally ready or whatever it is.
But has that changed from the 70s?
No. Those things have stayed mostly the same. I mean,
I apologize. I did not remember that.
No, it's okay. It's okay. I think, no, that's why I think it's always really good information to have, because we do have a lot of narratives around why people have abortions. And this is one of those things that I'm not sure if it's just the people who volunteered for our study or if this is representative of Jews moreover, but we have a larger percentage of people who've had abortions for what are called medical reasons or health reasons, but it's still the vast majority have had abortions for timing reasons. So we have maybe, I think 35%, maybe 40%, but still most of the people have had abortions for timing, but 35 or 40 maybe for medical or health reasons. But I can...
Do you know, is that connected at all to the fact that there are so many known Jewish genetic issues?
Yeah, so this is curious because I have to look into when we actually started systematically testing Jews before they got pregnant. And then when like prenatal testing was implemented, or is it that Jews are experiencing more diagnoses during pregnancy? I don't know. All of those questions are ways to answer, or all of those pieces of information are necessary in order to answer that question. I don't have that data yet, but it's good. Yeah, Addie, Jim, yeah. And then you will wrap up with you guys.
That amniocentesis came in 1978. Because that was the second year that it was in.
Okay.
And there's a whole lot more decision making also about whether or not to have an abortion.
Sure, but amniocentesis then wasn't, I mean, there was a lot of risks. So like there was a high rate of miscarriage with it initially. So you had to have a really good reason to get an amniocentesis at that point.
Yeah, but then they did tests that you could do a lot sooner, maybe 10, 12 weeks but the point I was going to make is about trying to test about the partners is very problematical with unmarried women, because a lot of times they never told the partner and don't want to disclose it for obvious reasons. So,
Yeah, I'd be curious if we release a study and call for participants among men, if we're going to get mostly people whose wives had abortions while they were married, or if any of them are going to be, I think some are in committed partnerships
yeah, right.
before they're married and they have abortions. But yeah, I probably the vast majority of men don't even know that their partner, their girlfriend had an abortion. Yeah, I think you're probably right. Folks, this was so fun. Thanks. Thanks for thinking about my data with me and helping me ask some more questions of it. I've got a lot to look into before April 9th. I hope I'm going to see you all there in person.
Thank you very much.
Okay. See you later. Have a good night.
Thank you.
Thank you.
Thank you.
Thank you. Stay dry.
You too.